I'm going to record to this computer. Well, good morning. I am so excited to have the opportunity to be here today with Dr. Marcella Nunez-Smith, who is, among many things, the Senior Advisor to the White House COVID-19 Response Team and the Chair of the White House COVID-19 Health Equity Task Force. And as we know, a friend to all in Connecticut. Thank you so much for being here with us today.
Oh, I'm so excited to be here. Thank you for this invitation.
So we know that you are quite a busy woman and an in-demand woman with these two really big roles that you have. I would love to just take a moment and hear from you in your own words, what your work looks like. What are these two roles and how are you doing these great big things that you're doing for us in this nation?
Oh my goodness. Well, thank you so much. It's just an absolute honor and privilege to be in service with this administration, with the Biden-Harris administration at this time, and to have these two roles, as you said. So, let me just, even for anchoring, so I'm an internal medicine physician first and foremost, and I'm, still here in our great state, proud faculty member at Yale, and also have taken on these roles with the administration. And the first that you mentioned was serving as senior advisor to the White House COVID-19 response team. It's a tremendous group of people. I tell you, this is a powerhouse team, just a couple of dozen folks, but who are working tirelessly around the clock. And all of these now issues in the pandemic. We work really with Jeff Zients as our fearless leader in that space. And it's incredible. I just have to say, it's really incredible. But first and foremost is making sure everybody has access to all the COVID-19 resources that they need, right? PPE, testing, therapeutics, and of course, vaccine and vaccination. So much of what I've been grateful to be involved with in that process has been on that equitable access piece. When it comes to vaccine and vaccination, of course, making sure that there is equitable access there as well. And then I get to also serve as chair of the COVID-19 Health Equity Task Force. Just, it's really this abundance of riches, because in that space as well, the people are phenomenal. We have an incredible federal staff team that supports us there, but I get to work with 12 outstanding individuals who bring their lived experience and expertise from many of the communities hardest hit in the pandemic to that space, as well as 8 ex officio members who represent several of our federal agencies and departments where we know the levers are when we think about the structural social determinants of health. And that group is advisory, and we're generating recommendations to give to the president through Mr. Zients to think, yes, about how we mitigate the disparities and inequities now, but also as we look ahead, how to build resilience. What I always say is we need to disrupt that predictability of who is harmed first and harmed worse in times of national crisis. And so I bring that lens and that North Star to kind of all the tables I'm privileged to be at.
Thank you. Thank you so much for first reminding everybody or telling some people that you're still here in New Haven and that you're still in Connecticut and that you're still doing all the great work at Yale that you're doing, because I know I've encountered a number of people who are like, oh, isn't she off in Washington, D.C. and she's not doing this anymore? And I'm like, no, she's serving the country and she's serving our nation and serving Connecticut and New Haven specifically at the same time. So tremendous amount of work. I am really excited about the priorities you just laid out in terms of the administration's work, centering equity and really thinking about not just the work we're doing or have done in the experience of the pandemic now, but also preparing ourselves for the future to reduce or eliminate that predictability of the relationship of race or ethnicity or geography to outcomes, particularly related to emergency issues. Could you speak a little bit more about some of the priorities that are unearthing for you all in the administration in this role?
Yeah, no, absolutely. And thank you so much. So, I would even kind of trace my story, back again, anchoring here in Connecticut on home. It was a tremendous opportunity when I was asked by Governor Lamont to chair the community subcommittee of the Reopen CT advisory group, right? And then that was kind of my first steps on this journey in terms of thinking about health equity in the COVID-19 pandemic, and really to just applaud Connecticut for being, one of very few states that from the beginning in thinking about reopening and addressing the pandemic said we have to think about those communities that are at greatest risk, hardest hit, and really dedicating that entire committee to thinking about that and sharing thoughts in that space. And so I brought that, that experience working with incredible leaders here in Connecticut across diverse sectors on that committee. Co-chairing that with Commissioner Porter, like just an incredible learning experience, co-learning experience that really does inform my view on the national landscape. Maybe to share a vignette, even during the transition, we worked so hard on that national strategy, that the president's national strategy and addressing and combating COVID-19. I always say, I don't know how many folks have actually read the national strategy. I always think like a nice evening read one time to take a look at that. But there are 7 goals there, and each one just with great intentionality and deliberation to get that real estate. And to kind of just lift up goal 6, which is our equity priority. And as you rightly said, focused on racial ethnic groups, and as well as thinking about geography and our rural neighbors specifically. There are many other groups. We take a very broad lens when we think about equity and COVID-19, but that's the top line in goal 6. And to know that it is woven. I mean, I work closely with everybody on that project and on that report. And so, coming up with a strategy where equity was at the center and the extra lifted up and underscored. And we have followed that. We have followed goal 6. We have really worked hard to lean into the values and principles everybody joining us today knows so well, putting community voice first, leaning on community expertise, community partnership. That has been integral every step of the way. Let me just say thank you, because it is not just whole of government, but whole of society, that gets us anywhere, and certainly gets us anywhere on that equity march. And here we are talking today at a moment where in our country, for perhaps the first time, we are not seeing any racial ethnic gaps in vaccination uptake. And that's specific to the COVID-19 vaccine for adults. But it's remarkable, and it's because of each one of you, frankly, going out there as trusted messengers, creating space for people to bring their questions, to be respected, addressing all those structural issues. Something we did in stage. We started off by saying we have to be sure where we cite vaccination venues. It's so important. Necessary, insufficient, right? We have to be thinking about structural barriers, and the president came up with plans addressing paid time off for people to get vaccinated. We work with the private sector around childcare and transportation options, and everybody knows this so well. But then being really, really intentional about those trusted messengers, and knowing, that for many groups, there are good reasons. We have not always proven ourselves trustworthy. There are good reasons to be to take one's time, perhaps, on that journey to vaccine readiness. And so to be respectful in that space always. But incredibly, incredibly inspired every day by the partners that come to the table with us in this work.
Thanks. I think that there's so much richness in taking a moment and looking at the document and reading it, because from my perspective, it moves way beyond just being a document, and you can parallel and see how you all are taking actionable steps, particularly like you said, around goal 6, to make this a reality. And I want to use that as a stepping point for my next question. You have had the privilege, luxury, whichever word you want to put in there, to be able to both see this from a national perspective, but also what's going on here in our state. And as the Connecticut Public Health Association, one of the things we started saying very early on is that we're seeing a moment during this pandemic where our healthcare system and our public health infrastructure and our public health system are meeting to speak in a way that we haven't in a very, very long time. In a very, very long time. And so we're learning some real clear gaps that we need to fill in order for our public health response and our public health infrastructure to be able to work going forward through any emergency and for any community to not be left out with the medical system to be much more seamless. So if you had a magic wand and could make everything better or right or perfect in Dr. Nunez-Smith's world in Connecticut, what are some suggestions or places for growth in our public health infrastructure here in our state?
Yeah, I love that framing. And I'm really hopeful that we can meet this moment and history will judge us for it. I think one of these lessons learned is exactly what you said, which is we've seen, a lot of sort of silos perhaps fall because of the necessity and urgency of the moment. And I think about that in many ways. I know even thinking about sectors, even when we think about things like intellectual property and other issues, and we've been able to address them. But certainly I think one thing is we recognize now that, wow, we did have some walls up between our healthcare delivery systems and our public health infrastructure. And maybe in some ways, that first reality, it came as a surprise to some. And we have some great bright lights of where those walls came down quickly and needed to. And I think it's the right question. Hopefully we're at a point in the trajectory of this pandemic where we can be asking questions about, so what next, right? How do we build upon the positive lessons we've learned? I think I would probably use this moment to nod to the work of the task force, because this is just one of the core, I think, areas of focus for the group. I mean, just thinking where we are. So the task force at the end of September voted on the final recommendations. They number actually over 300, but there are 55 of those that are sort of finalized, prioritized recommendations. And then within that, we've kind of named 4 outcomes we'd like to see, and then 5 kind of overarching priorities that we think are really important moving forward. And the task force is looking not just at the federal government and administration as a reader, as an implementer of this work and of that final report that will be submitted to the president, but thinking about states as well and local jurisdictions, and hoping that everyone sees some helpful guidance on that work moving forward. But one of the top lines there when we talk about those overarching priorities, making sure that we have community-led solutions, that we're investing in that we are bringing the expertise to the table of those with lived experience. Communities are always expert in what's needed. So even when we frame this question of like, what should our public health infrastructure look like and be, we need to be in partnership with the communities that we say that we have been made vulnerable by these structural realities, that we are centering on community voice and the situational wisdom that resides there. Many people have heard me talk already about data. So we talk a lot about data in the task force. We talk a lot about data in our final recommendations. We need a data ecosystem that will support equity-driven decision-making. That is just a non-negotiable. And so there are many efforts I know underway to improve the quality and the reporting of our data, particularly on these relevant variables. But we need that. And we need that as we think about public health infrastructure and rebuilding that. We all need to be marching and rowing in the same direction. So we need to kind of have some shared metrics for accountability and the health equity landscape. And I think part of that is going to be about public health infrastructure. And then the task force explicitly, as its sort of 4th lift up point, says what you said, right? We have to be investing in our public health infrastructure. We have to be thinking in a way that ensures both representation across our healthcare and public health workforce, but that the resources are really there. I've been excited to see so many initiatives around community health workers, for example, and others, and we need pathways, of course, to sustainability there. So I am a huge champion of saying, let us not return at all to normal. I always have a bit of a reaction there because I was like, normal was not working for many people. But I do think we can get to a new and better one, and investing in a robust public health infrastructure, locally is the first step to that.
I love this frame because you also offered, we don't have to start from scratch. There is the task force who has a list of recommendations that we should be examining on how we adapt those to what we need to do at the state, local level in Connecticut. We don't have to make up new ideas. We can search, because you all did a lot of work there, and I applaud you for that work. Over 300 recommendations is a lot, and I think it's a lot because there's a lot that's necessary, not a lot of unnecessary work, right? And I think a lot of people would see that and say, oh my goodness, that's so much. But you can chunk that down, just like you said, 55 that are really good, but we can chunk that down and adapt it here. I think that's a really great way for us in our state to really move forward. And I think our entire conference is centered around policy and the policy implications coming out of the pandemic, but also moving forward for a world. So like really addressing that policy arm of what public health is supposed to do. And one of the things that I heard in what in your response is, we need to think about what are the policy levers that we need to pull in order to strengthen our public health infrastructure in Connecticut. And strengthening doesn't mean something was wrong or bad or poorly done. It just means that if we're looking for a new normal, a new place where people aren't marginalized or left out left out on the margins or in vulnerable positions in response to public emergencies or in anything, what is it that we need to fund and build in order to make sure that that's the world we have?
Yes, yes. I mean, I have tremendous appreciation because I think what we have had a collective witnessing too is just the amazing capacity of public health professionals and colleagues in this moment, right? To do so much with so little in most cases. And I think that, I see this too in our healthcare space where we invoke heroism. And I think that there's certainly deep appreciation, but we have to move forward from that to say, well, what resources are needed? And I think, I'm a public health professional. I think this is an incredible field and discipline to be a part of. And so, how are we ensuring that we're training that next generation as well? This is not our last public health crisis. This is a truth we know. And so this readiness, and I think that is one of the greatest lessons, right? Is that we weren't ready. And so I think it's non-negotiable, really, the need for investment at all levels in our public health infrastructure. I'm so grateful for you saying that, we are not starting from zero, we're starting from amazing. And whether that's when we're in the health equity space or the public health space more broadly, because certainly I always say the reason why we as a task force could really get a tremendous amount of work done in 8 months. I mean, our deliverables also include an implementation plan and accountability framework as well for those implementers who are looking to adapt these recommendations. But the reason why is because we're all standing on the shoulders of giants, right? This is not a new field. Health equity and the scholarship there is not new. And it's the same in public health. Like, we are not now trying to think of what needs to be done. We've all known for a while, right? What we're looking for is will and commitment to doing it.
I love that. Well, I know that time is important and your time is valuable, and we don't have a lot of it left. So I want to get into what I like to call the humanizing factor. You just said a moment ago, heroism. I mean, how did you know what my next question was going to be? We look at leaders who, like you, who are doing extraordinary work, again, not just for our nation, but also in Connecticut, and the people that you serve every single day. And, hey, applause to you and applause to the administration, but also you're a real person. So I just want us all to remember that, right? The people who have worked throughout this pandemic, we've redefined what an essential worker has been. We've looked and seen the heroism of everyday people and the difficult positions that we're in. But even through all of the work we've done, public health professionals and otherwise, we're all real people. So I just want to take a second and ask you, what do you do as a real person to unwind in this most difficult time? What's recharging for Dr. Nunez-Smith?
Oh my goodness. Thank you for asking. It's incredibly kind and generous of you. And I think there's no better way to wrap our conversation than that focus on well-being. One of the things that does keep me up at night is worrying about everybody who's in this space and in this work, right? And saying we have to do that time for self-care. Even when I talk about, hospitals and hospital capacity, I say to people, this isn't an issue of beds, right? Or number of ventilators, it's people. And we have to be nurturing and nourishing to ourselves and one another. And there are a lot of things that bring me joy. I'm grateful. I have many, many, many gratitude moments. And taking that time to recharge is key. I have 3 young children who are just central to that. And keep me very honest in that space because, they still need dinner and they still need to be dropped off and picked up from their events. And there isn't a whole lot of worry about other things. And I love that. And it is joy making for me to be a parent in this moment and to watch them and have so many opportunities to see them grow. But, I, like everybody else, right, we got to do the things to keep ourselves well, the physical activity and getting out there. I love to sort of spend a little bit of time just in nature. Here in Connecticut, we have amazing state parks and others, and I take full advantage of those as well. And then staying connected to friends and family. I mean, this is yet another lesson learned on the personal front for us during this pandemic, and the value of relationship and telling people who you love that you love them. And so my friend Tekisha, I'm very grateful for you, and I am thankful for your leadership in this time. And having this conversation with you is rejuvenating and brings me joy.
Oh my goodness. Thank you so much, Dr. Nunez-Smith. I wasn't expecting that last one, so I'm trying to recover from that in the moment, but I do appreciate you. And I am thankful for you to have a live gratitude moment. I am so thankful to you and grateful that I'm a faithful person, so I will put this out there. Thankful to God that he put you in such a place and at such a time as this. We couldn't have a better public servant who is of the people and from Connecticut, where we're talking about the people, representing us in Washington, D.C. So I'm excited that the administration chose you and chose wisely. I am also thankful that you chose to be with us today. And I want to applaud all of our listeners in having and offering us questions. We couldn't get to all of the questions that were offered, but I did have an opportunity to talk to Dr. Nunez-Smith about many of the questions, and she has directed us to guidance and the website, looking at what the task force has already put forward and the work that is happening for the COVID-19 response team, so we can all look to whitehouse.gov for that important information. Again, thank you so much for being here. And we really, on behalf of the Connecticut Public Health Association, am excited about you, your work, and thankful for your time.
Oh, goodness. Everybody, be well. Thank you so much.